Next time you go to a doctor for a routine checkup, you may receive some advice about your cell phone. We warn you, some of the video you're about to see is graphic. News 4's Dr. Peter Ostrow reports now for your health.
We all know the tragic consequences of not paying attention while you drive. This British public service video shows an all-too graphic example.
Very, very dangerous, and most of us are guilty, if not actually texting on your phone while you're driving, trying to look at a message when it may have beeped to go off.
39 states have passed laws regulating cell phone use while driving, but cell phones are responsible for 28% of all crashes in the U.S.
But this is actually a recipe for total disaster.
Dr. Sperry counsels his patients to avoid things that are unhealthy. There's a checklist of things to discuss. Patients are routinely asked about and offered advice on smoking, drug and alcohol use, diet, and exercise. Those are obvious issues between a doctor and a patient. But there are also safety issues that impact your health: wearing seat belts or bike helmets, having smoke and carbon monoxide detectors in your home, and avoiding too much sun exposure.
And I think by having these items on a screening grid, you're becoming more proactive with the patient, helping them to identify certain risk factors in their life.
This week's New England Journal of Medicine suggests we should also talk about distracted driving. Dr. Sperry thinks that's a very good idea, and here's a way to make the point. How would you feel if your surgeon was on the cell phone, hands-free of course, while removing your appendix?
I don't think they want your surgeon to be doing that, Total focus, total concentration, especially when you're driving.
Cell phone use in cars may not seem like a medical issue, but, when doctors advise patients, it works. Reminding people to wear seat belts works. Repeatedly counseling people about smoking helps motivate them to quit. So doctors talking about cell phones might help. Driving while talking on a cell phone is just as risky as driving while intoxicated.
Now, we've heard that before, and here in New York State, the big push has been to, if you're going to talk on the phone, talk hands-free. But in terms of what's happening in your mind, is there any difference at all in terms of distraction?
The difference that they talk about is between that and just talking to a passenger in the car with you. And there are some studies that say that those two things actually are different. The mind is diverted in a different way. The passenger sees what you see, okay? And the passenger stops talking to you when you have to maneuver in traffic or something like that. So there is a difference. There is a difference. Even a hands-free isn't completely safe.
Okay. Thanks, Doctor.